Diagnosis of bipolar remains difficult, and opinions vary due to the symptoms common to depression. In research underway at the Westmead Institute for Medical Research, Dr. Mayuresh Korgaonkar talks about the importance of finding biological markers in diagnosing bipolar disorder.
My name is Mayuresh Korgaonkar and I'm the Research Director at the Brain Dynamics Centre here at the Westmead Institute for Medical Research and University of Sydney. My research centre works towards understanding the brain, in understanding the brain underlying mental disorders. So our research is specifically targeted towards how we can use this understanding to help people with mental disorders. Today is World Bipolar Day, and we are here to do a community event where the goal was to spread awareness of this disorder, to basically understand the stigma, to help people understand that this is an important disorder, but there are resources. There's a lot of research and clinical activity which is going on to help this disorder. So today we had a community event here at the Westmead Institute for Medical Research around World Bipolar Disorder Day. We invited people from the Western Sydney, typically the entire Sydney community, and we had a first event where we blew bubbles. Bubbles symbolizes the mood of bipolar disorders. Bubbles meaning when people with bipolar disorders are manic or happy, and when bubbles burst, they feel depressed. So patients with bipolar disorder can go between the manic and happy states and the depressed states. After that, we had a exciting panel discussion with experts, clinicians and researchers, where we talked about how the community for the community to understand how bipolar disorders is diagnosed, how the disorder can be detected by family members, what sort of help is available for these people, how do clinicians typically treat people with bipolar disorders, what's the impact bipolar disorders has on people's life and their families. And we also discuss about the type of research which is happening in this disorder and how this research is geared towards helping people with bipolar disorders. So our research study is funded by the National Health and Medical Research Council of Australia, and our research is geared towards identifying biomarkers of bipolar disorders. One of the problems with bipolar disorders is that there's a significant delay in diagnosis of bipolar disorders. Often people with bipolar disorders get misdiagnosed as depressed, and that's because clinically there's a huge overlap in symptoms in both these disorders. So the main problem with this is people with bipolar disorders don't necessarily get the right treatment earlier on. And there's often a significant delay from the onset of the disorder to actual diagnosis, and which means it has a significant impact on someone who's suffering with bipolar disorder. So our research is mainly targeted towards that question, where we want to compare people with depression and with bipolar disorders. We are using cutting-edge tools to understand the functional and structural architecture of the brain and see if we can identify biomarkers which can tease apart these disorders. So eventually these markers could help clinicians in their clinics for an early diagnosis, to get an appropriate diagnosis, and for someone with bipolar disorder to get the right kind of treatment earlier on.